Hi, I'm Colleen.
Hi.
It's nice to meet you. I'm here today because I've never had any kind of birth control and I wanted to start, but I wanted to know a little bit more about the different types of birth control.
Okay. Hi, Colleen. I'm April. The nurse here. It's nice to meet you. Come to the right place. We'll start out talking about the best methods out there. Something called LARC, and that stands for long-acting reversible contraception. One of the first method I'll show you is the Nexplanon. And the Nexplanon is actually an implantable form of contraception. It gets placed right under the skin in your arm. It's really easy, simple procedure. And this is a fake arm, so you could just feel that to kind of give you an idea of what it feels
Oh,
like.
you really can barely feel it.
Right. And we can talk about that one more a little bit later. Also, the IUD is another great method. And there's two different types. There's the Mirena, which is a low-dose hormone. And this is actually a device that we use to place it. So, and this would be just a replica of your uterus.
Okay.
So it would get placed during a GYN exam into your uterus, and the cervix would act to hold it in. The cervix is the opening of the uterus at the very back of the vagina. They would trim the string, so it would be placed right there.
Okay, so that's really small. That's
Very,
like that big.
Yeah, very small. And, like I said, it's in the uterus, so you wouldn't have to do anything at all with it. And the Mirena is good for 5 years. And the other type of IUD is called the Paragard, which is a hormone-free method.
Okay.
It's placed in the same way, and it's good for 10 years.
Okay.
Mm-hmm.
So would I have to take a pregnancy test if I wanted to get one of those?
We would require a pregnancy test. We just want to be on the safe side and make sure you're not pregnant before starting the method like that.
Okay, and then what about a GYN exam or a pap smear? Do I have to get those before I start?
Well, a GYN exam is recommended once you're sexually active to have that every year, and a pap smear, which is actually screening for cervical cancer, that's actually done at 21. We recommend it, don't require it. So if you wanted to start the IUD, we would actually have to require it just because it's actually getting placed in the uterus, and we want to screen to make sure there's no type of infection before we place something like that in your body, because it could increase your risk for something called PID, pelvic inflammatory disease, if you had an infection when we placed it. So the answer to that one is yes. If you wanted to start the next one on today, we would not require that you have a GYN exam. We would just recommend that you would come back for routine screening when you're able to.
Okay. So if I wanted to do one of those, would I be able to do it today?
The exam?
To get one of the birth controls placed.
Oh yeah, sure. We could go ahead and start the next one on today if you'd like. If you are interested in the IUD, we could do your exam today and bring you back in 2 days once we have the result to go ahead and place it. And there'll be some instructions that I'll give you prior to coming back for that.
Okay, well, thank you.
You're welcome.